Hi, and welcome to our presentation on Medicare and Medicaid group. This is our trifold brochure. Members of the group are myself, Patricia Dillingham, Cheryl Garner, and Christelle Tongbong-Nebo. And I'm sorry, Christelle, if I pronounced your name incorrectly. So we're going to look at the difference between Medicare and Medicaid. Okay, we're going to talk about the costs, the different plans, and just the difference between the two. I think it can be confusing to some people who have not had any experience with Medicare or Medicaid. At this point, we've probably had some experience having patients having one or either. So we're going to talk about the differences briefly here. So on the first page of our trifold pamphlet here, you'll see information about Medicare. Medicare is an insurance program. It is essentially the same everywhere in the United States and is run by the Centers for Medicare and Medicaid Services, which is an agency of the federal government. Medicare provides health care for all adults 65 years old and above, regardless of income, and younger people with certain disabilities and dialysis patients. So generally, this is the insurance that we all get when we turn 65. There are some exceptions, as stated. Persons with certain disabilities and dialysis patients can also qualify for Medicare even if they aren't 65 and older. Okay, Medicare has some advantages over private insurance policies. For Part A, there is no cost, provided you meet eligibility and income criteria. Other plans, Medicare B, C, D, and supplemental, offer savings on premiums, and no one can be denied coverage for pre-existing conditions. The costs are varied, and it's based on numerous factors, but a basic outline is as follows. Part A is mostly free for participants. Part B requires a premium and is based on income. And Part C, D, and supplemental insurance are private plans with monthly premiums. There are some different plans, and that's A, B, C, and D. Part A is hospital insurance, Part B is medical insurance, Part C is Medicare Advantage, and Part D is prescription drug benefit. Medicare supplement insurance. It also covers what plans A and B do not. So that is an option, and that is why it's referred to as supplemental. So that's Medicare in a nutshell. Moving on to our second page of our pamphlet, you'll see information about Medicaid. So Medicaid is a joint federal and state program administered primarily by state governments. And Medicaid is an assistance program. It serves low-income people of every age. So one of the big differences between Medicaid and Medicare is that Medicaid, anybody can have it based on their income. It's solely based on income. Each state has different eligibility and application requirements, however. So generally speaking, Medicaid provides health care coverage for low-income adults, as I stated before, for pregnant women and children. The benefits of Medicaid is that it covers doctor visits, in and outpatient services, mental health, necessary medications, prenatal and maternity care, preventative care, and in some cases it covers nursing home and in-home health care services. So patients usually pay no part of costs for covered medical expenses. A small co-payment is sometimes required. Medicaid varies from state to state, and Medicaid is available only to certain low-income individuals and families who fit into an eligibility group that is recognized by federal and state law. Medicaid offers primarily the same plans with variations of coverage and services dependent on the state in which a patient resides. There are two general types of Medicaid coverage. Community Medicaid helps people who have little or no medical insurance, and some states operate a program known as Health Insurance Premium Payment Program, also known as HIPP. This program allows a Medicaid recipient to have private health insurance paid for by Medicaid. So that is Medicaid. A brief summary of Medicaid. So you can kind of see the side-by-side differences in our brochure, and our references are listed on this last page, the third page of our brochure here. If you guys have any questions, feel free to reach out to us via email, and we'd be more than happy to answer any questions. Thank you for watching our presentation.